doctor, I want to ask you, every once in a while you hear people talking about the baby dropped. And I'm just wondering, does that mean anything in the medical world, or what does that mean if you hear someone say the baby dropped?
That's a good question. We get that question all the time in our office as well. Basically, for the medical professional, that means the baby is engaged in the pelvis, that the head is at a low enough in the pelvis. It can cause a little bit more discomfort for mom, a little bit more aches and pains in the joints and in the pelvis, but it doesn't necessarily mean that labor is upon them. It really can happen a few weeks before labor occurs, and it can happen certainly just during labor. It doesn't necessarily have to happen ahead of time.
Okay, that's good to know. Now, doctor, of course, you mentioned contractions, kind of a big sign of labor. I think most people know that. But we also hear about Braxton Hicks contractions, sometimes referred to as practice contractions. And I'm wondering, is that a valid term? And also, what exactly are these Braxton Hicks contractions?
Sure. So Braxton Hicks contractions are named after the person who discovered them, basically, as a lot of things are in science. But they basically are a way of the body and the uterus kind of practicing and getting ready for labor. They don't really necessarily get the cervix ready, but they just kind of get the receptors and the hormonal milieu ready for labor. They're typically irregular, so they do not come at consistent intervals. Usually their intensity is less, although they may be perceived as painful. They're typically more discussed as uncomfortable. Okay. If they do become painful, they certainly are a reason to go into the hospital. And if they respond to pain medications, typically it's not true labor.